Good morning. Want to get California Today by email? Here's the sign up. For years, transgender men and women looking for genital surgery have primarily relied on doctors in private practice, sometimes paying tens of thousands of dollars out of pocket. Recent studies estimate that roughly 1.4 million adults, including 218,000 in California, identify as transgender. While not all of them want genital surgery, it can be prohibitively expensive for those who do. As a urologist at the University of California San Francisco Medical Center, Maurice Garcia had several transgender patients. He began looking for a place to receive training for genital surgery for transgender adults and adolescents, but with no academic medical centers in the United States that could offer such training, he traveled to England for a year-long fellowship at University College London. When he returned to UCSF in 2014, he created the system's first transgender genital gender-confirming surgery program. Earlier this year, he began something similar at Cedars-Sinai in Los Angeles, the Transgender Surgery and Health Program, making the hospital one of just 2 academic medical centers in the West to offer gender reassignment surgery. Over the last several years, California has passed laws requiring insurance companies to cover the procedure, as well as Medicare and Medi-Cal plans. Still, Garcia said, many of the doctors in private practice would not accept public insurance. People in leadership at Cedars had either close friends or family members who were transgender and were attuned to the needs of this population, he said. My feeling was that if I was going to be the only public provider here, we had to offer it to all parts of society. He has now done more than 100 surgeries at Cedars since he began performing them in March, including several through Medicare and Medi-Cal, such as Liz Young's, a 50-year-old office worker who lives in Tustin. Ms. Youngs waited for years for surgery that would help her live as a woman. This April, on her 50th birthday and less than 5 months after initially meeting Garcia, she got her wish. I had really been hopeless, she said. A friend told me he would accept Medi-Cal and I wanted to be the first one on his operating table. It was a huge relief. Please note, we regularly highlight articles on news sites that have limited access for non-subscribers. Guns that can be made at home, often referred to as ghost guns, are facing renewed scrutiny after a shooting in Northern California earlier this month. The New York Times Assemblyman Raul Bocanegra said Monday that he would step down immediately, rather than next fall, as he originally said last week when 6 women accused him making unwanted sexual advances. He is the first lawmaker to resign amid charges of widespread sexual harassment and assault in the state capital. The Los Angeles Times. Democratic State Senator Tony Mendoza was stripped of his leadership positions, while an investigation into sexual harassment charges from 3 women continues. The Los Angeles Times.